So Ignaz Semmelweiss is a very interesting example of an early effort to make improvement and how things can go wrong when you try to make improvements in healthcare. He was working in Vienna in the 19th century, and he noted that rates of puerperal fever were much higher on some wards rather than others. And he managed to work out that the probable cause of puerperal fever was linked to practices of medical students going from conducting autopsies to then looking after women who were being taken care of in the wards. And he also worked out that the problem could be controlled by better hand hygiene. However, his increasingly strident efforts to get physicians to comply with hand hygiene became increasingly resisted, to the extent that he was eventually hounded out of the hospital and died in ignominy back in Hungary. That's actually quite a well-known story, but perhaps a little bit less well-known is that in fact the story started some years earlier. So puerperal fever really emerged as a major problem when births began to move into hospitals, thereby increasing the risk of infection. In 1795, a physician in Aberdeen known as Alexander Gordon made exactly the same discovery as Semmelweis, and in fact found exactly the same solution, but he ran into exactly the same problem when he tried to get his colleagues to comply and was also hounded out of town. And when, just a few years before Semmelweis, a surgeon known as Oliver Wendell Holmes published a book about puerperal fever in which he recommended hand hygiene as the solution, he was ridiculed, and the other surgeons said that a gentleman has clean hands, doctors are gentlemen, therefore there's no need for any further precautions. And at that time, the standing of a surgeon was judged by the extent to which his coat was stiffened with blood and guts, because that implied that he was very busy. So I think what we can learn from that is that improvement is not just about establishing scientific facts, it's also about how we manage resistance to change, threats to professional identity, and how to make sure that when discoveries are made that are going to help patients, that we are able to smooth the path to implementation rather than put obstructions in the way.